Yeah, so we've got great providers here, as you know, from Elaine to Nessa to Emily. They both have a strong interest in women's health. That's an area that they consistently see
Uh-huh.
that there's a need in our community. And one of the biggest things that Emily talks about is that her frustration is if a guy comes in and talks about his back pain, he leaves immediately with a referral for help for his back. It's
Yep.
commonly accepted, and there's multiple avenues. Nobody leaves it untreated. But if
Right.
a female talks about pelvic pain, especially around childbirth, well,
Yep.
it's just because you're pregnant, so it'll go away when it's over. Or when they talk about incontinence, well,
Mhm.
it just happens when you get older,
Yep.
and you hear it from medical staff, but also relatives. Yep, I've lived with that forever. That's just how it is, honey, when you have kids, types thing.
Mhm.
And so they don't always get the services that they need to help them in their lives to correct some of those issues. So yeah,
Right.
no, we've got three great people that love getting after it. Some of these that I'm going to go over do affect men as well. So we're not just talking only about women and pelvic pain, because that's typically where a lot of the services are related to, but men can have some of these pelvic pain issues as well. I have quite a few of these, so I'm going to kind of summarize them, and then when we break out again, if you want me to re-hit some of them that draws your interest, we can certainly do that. Okay, so pelvic pain itself, it could be a sinus symptom related to multiple different functions in your body. It can be a urinary tract issue, it could be a reproductive organ issue, it could be a digestive tract issue, or it can be different nerves that are around your pelvis that are intertwined in the soft tissue of the pelvis. So some of those causes of pain, like menstrual cramps, those can be normal or not always something that you have to worry about. But other causes of pelvic pain can be more serious, and they can require a trip to your doctor or possibly the hospital. So knowing which symptoms are which will help guide you figuring out when your pelvic pain is immediate, needs to be dealt with right away, or if it's something that's naturally a part of your monthly cycle or the process of being alive. So let's take a closer look at these. The first one I want to review is a urinary tract infection. Now, typically we see this more in females, but again, this is a bacterial infection that includes an infection to either the urethra, the bladder, the ureters, which are the long vessels that go from the kidneys down to the bladder itself, or the kidneys itself. So anything along that tract can become infected. Number two, which is a very common one for men and women, common in the sense that it happens to almost 500,000 people every year, is sexually transmitted diseases. So gonorrhea, chlamydia, top two that occur every year that cause pelvic pain. Uh, Anywhere from 500,000 to 2 million people a year will get gonorrhea to chlamydia, and it usually happens at a younger age. The third one that we hear quite a bit for men and women are hernias. And some of you might have had a hernia, or somebody that's had a hernia. And the hernias themselves occur when that organ or the tissue starts pushing through a weak spot in the muscle of the abdominal region, and through pressure, lifting, uh, pulling, carrying, where you're exerting a lot of inner abdominal pressure, over time can continue to weaken that wall. Another one that's very common, you probably heard of multiple times, is appendicitis. But the appendix is just a thin tube that's attached to your large intestine. But the problem is it can become inflamed. Number five, another common one, kidney stones or a kidney infection. Number six, cystitis. So cystitis is an inflammation of the bladder that's usually caused by an infection of the urinary tract. Number seven, and this is another common one for men and women. I hear it a lot in the office when I'm going through past medical history. And I usually have one a week that tell me I have irritable bowel syndrome, IBS. And IBS is a condition that causes intestinal symptoms like cramps. Got a couple more here, and then we'll break out. One is pudendal nerve entrapment. I mentioned before how you can have nerves that are being impinged by muscles in the pelvis that cause symptoms, and this can happen in men or women. So this rounds out my last one I have for both genders, which is adhesions. And adhesions are bands of scar-like tissue that make organs and tissues in your abdominal region stick together. And you can get abdominal adhesions after surgery if you've had an abdominal surgery. But about 90% of people who have abdominal surgery develop adhesions afterwards. So it's pretty common. But the adhesions themselves don't always cause symptoms. But when they do, belly pain is the most common symptom that is heard.